Hello, welcome to our presentation on how an EHR system with health information exchange is better for you. Presented by Fong Lee, Portia Moore, Tiffany Davis, and Ryan Kazi. Well, first, what is health information management? Well, that is managing a patient's health record and transferring the papers to electronic records system. But basically, paperwork are usually on paperwork, so you're going to change. Most healthcare facilities are changing to electronics. Why does this benefit you? It's very convenient for patients, doctors, and nurses to have quicker access information, where this is where patients can log in on different electronics to do different things, so you can have quick access. The doctor and nurses can help you at your appointment faster, and also decreases information needed every time visit. So that decreases on paperwork that you have to fill out every time that you go to visit your doctor. And it also is good because your prescription can be automatically sent to the pharmacy, whereas they give it to you and you have to go sit at the pharmacy and wait an hour to your prescription. So that makes it easier for you also. It's also bringing the patient closer. You have more understanding of what's going on. You can be able to log on and see what you have in front of you, so you don't have to try to remember what the doctor's saying, or you just can log in and see for yourself. So that helps you and your family members to keep track what's going on with you. And the doctors can add information and instruction for you, so he can add reminders, self-care instructions. So there's a connection that you and the doctor can have to help better care for you. And increase safety. I have learned over time that there have been many medical errors with handwritten mistakes, people scratching out information, people trying to overdo the mistakes they've done on paper, whereas computer, you can always erase backspace and make things more neater, and that really helps you, the patient, safety on not having any medical records errors. And there's times that people have lost the patient's paperwork and files, information, and HIPAA's broken if people find information. So this better takes care of the patient's safety and security.
Okay, 3 ways to a patient's success: access, action, and attitudes. Access to your medical records immediately. You can use Facebook, Twitter, mobile apps, tablets, smartphones, computers, which everyone is really using Facebook, and I'm pretty sure everyone has a smartphone by now. Some type of internet computer, whether it's at your job, whether it's at home, some type of access to any kind of computer. Action. Patients are taking actions in control of their own health, meaning as they're becoming more aware as a patient point of view. You are being more active in your health. You are becoming aware of what is actually taking place within your notes. You're understanding from a doctor's point of view and from their nursing staff. Actually, they will provide you with email response right away. Instead of calling, leaving voicemails, just type in the email and the nurse staff will give you a response right away. So no more calls and appointments, making those late appointments. Just click on any kind of app, your cell phone. If you're at work and you're busy, just click on and make your own appointments. Also, our staff will send you friendly reminders instead of leaving voicemails on your phone as well. We'll there just send you out an email verifying your appointments and everything. Also, as a patient, your health prescriptions or any information is updated automatically within your hands. If you want to know anything about your prescription needs to be refilled or anything, just type in, send an email, and everything is there, just in a blink of an eye. Attitudes. Coming as for a patient attitude, some of our patients are kind of iffy about saying, well, maybe it's not, I'm too old to get online, or I'm not aware of different types of smartphones, I'm not aware of using, but everything is easy. If you have an app on your phone or any type of Facebook, your kids, grandparents, anyone can help you get on to the mobile app. Even our staff, if you want to call and ask a couple questions, we will also help you get on the website. We're trying to give you a new attitude on your health, on how you feel towards as checking your different types of medical records online, and just giving you a better feel about your health care. Also, it's very privacy access online, which patients feel more privacy than looking at it and actually coming from a doctor's point of view in person. A lot of people are in a closed place, or you at work and you're taking a break and you want to say, hey, I just took a test, let me see if my lab results are back, instead of having that doctor call you and say, hey, come in, da 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 da. No, it's right there in the blink of an eye. Once those lab results comes in, it's accessed right back to you online. Patients are like second eyes. We're using you guys as second eyes to help us with errors, any kind of mistakes that we are making, or anything that you see that needs to be action wise. It's for you to look in your own health records, it's for you to understand your health as a patient and taking a new attitude into your health instead of leaving it all in the doctor's hands. Now it's in your hands as a patient.
Hey guys, my name is Ryan Causey, and I'll be talking about the different interfaces for EHR systems today, and how beneficial they can be for patients. One of the best things that is most useful is the extensive communication between management, physicians, nurses, and patients. So instead of having large amounts of charts that need to be passed around a hospital or anything of that nature, all the information is readily available on any of the devices that are compatible with that health record system. Which brings us to the next point of different cross-platform uses that allow for any desired device. Meaning, if a doctor had an iPad, for example, he would be able to pull up the same information as a patient on their smartphone on the subway in between visits, or a patient at home looking at their visitations, medical history, any of the information that they had access to just from their personal computer at home. So the cross-platform allows a broader spectrum of use between physicians and patients. This mainly comes into play a lot with doctors who have different types of tablets. If a doctor has an Android-based tablet or an iPad, they want to make sure that they're all compatible with that electronic health record system. Another really good benefit to it is that information can be easily shared directly with a patient. So a physician can come into a patient's room with all of their stats and everything that they would need to know right on his tablet, and easily show the patient exactly what all the lab results showed, what their blood pressure is, if they need any other lab work done, and that way there would be no question by the patient. Everything would be completely out in the open and easily understood. So another good thing about all of the cross-platform interfaces and everything with electronic health records is how easily information can be shared. So a physician can have all the medical information in their hand to show a patient when they enter the room. This information can be easily sent to or accessed by anyone at the hospital at the exact time, as long as the information is entered and saved. So 1 second after a physician saves all of the lab work from a previous visitation, a patient would be able to look at that either on their smartphone, tablets, or anything immediately and know exactly how the results were, instead of having to wait, weeks at a time and then coming back into an office. That in itself is going to save a lot of time for the patient and for the physicians. And another really beneficial thing is that patients are no longer going to have to come into the offices to get all that information, like I just mentioned. So you could easily sit at home and check on how your medications are doing, any lab results, images, if that electronic health record system allows the patient to see that, any doctor's notes. So if a doctor maybe sees something that's abnormal and wants the patient to come back in, or the system itself automatically flags that any results as being abnormal, then the patient can be notified directly from home, or on their smartphone or tablet, anywhere that they could be connected. The last benefit of different interfaces is how easy it is to use from people that don't have a strong medical background. So information, any of your billing claims, immunizations that you might need to get checked in on or updated, disease management, if you needed any kind of special treatment, then that information is all readily available and easily accessed, as well as past medical history, past surgical history, and any visit history. That would be extremely beneficial if you were looking, or if you went to a different hospital, for example. Then that physician would be able to access all of your visit history or your past medical history extremely fast and efficient. The latest in ease of use is that nurses and secretaries would have the ability to schedule lab results. This means that physicians are going to have a lot more time to deal with critical issues if the systems themselves will be able to set up mass or automatic detection of abnormal lab works or anything like that, or any abnormal tests, so that the nurses or secretaries would be able to schedule those lab results without notifying the physicians. Or I'm sure they could get the physician to check off on it, or however the system was set up. And then again, with that, automatic notifications will be sent to patients just in case they may have forgotten about any kind of medication that they needed to get renewed, or a checkup that they had in a few days. An electronic health record system would be able to automatically notify them and make sure that they got to those visits on time.
All right. I will be speaking about meaningful uses for the electronic health records and health information exchanging. Meaningful uses improve quality, safety, efficiency, and reduces health disparities. Engages patients and families, improves care coordination in populations and public health. Maintain privacy and security for patient health information. Basically, those uses is really specified for the CMS incentive program. Basically, if the physicians and nurses at the clinic doesn't use the meaningful uses and show proof, then they wouldn't get money from the government. And the result would better the clinical outcome if you use the meaningful uses. It improves the population health outcomes, increases transparencies and efficiencies. It empowered individuals, and basically where patients could interact with physicians and through the web with the apps that they're going through and see their information if they follow through correctly on the interfaces. Electronic health information exchanges allow doctors, nurses, pharmacists, other healthcare providers, and patients to appropriately access and secure shares and patient vital medical information electronically, improving the speed, quality, safety, and cost of patient care. So it would help them avoid readmissioning, medication errors, improve diagnosing, and decrease duplicating the tests of what doctors order. The 3 keys of forming of a health information exchange is basically following HIPAA, direct exchanges, ability to send and receive secure information electronically between care providers to support coordinated care, so nobody can look into patient privacy informations. A primary care can directly send electronic care summaries that include medication problems and lab results, what actually Ryan has said through the interfaces. Also, the query-based exchanges ability for providers to find and request information on a patient from other providers often use unplanned care, which, based like an example of emergency room physician can utilize query-based exchange to access patient information such as medication, recent radiology image, and problem lists, might adjust treatment plans to avoid adverse medication reaction or duplicative testings. And if patients interact, this would actually help them to watch their health even better. And physicians can interact with them, advise them anything to save them money, save time, and basically that's it.
And this will conclude our video presentation of explaining the benefits and of having an EHR system that connects to health information exchange. We hope you learned something and see all of the benefits that everything actually has. Thank you.